What is an ingrown toenail? Cutting your toenails too short, especially on the sides of your big toes, can lead to ingrown toenails. Many people tend to round off the corners when trimming their toenails to match the shape of their toes. However, this method can make your toenail grow into the skin of your toe. The edge of the nail can curve down and start digging into your skin. Wearing shoes that are too tight or too short can also cause ingrown toenails. The following is how the ingrown toenail presents. When you get an ingrown toenail, it can start off feeling tough, swollen, and sensitive. As it progresses, it might turn red, get infected, and become very painful. Ingrown toenails are a common and painful issue, especially among teenagers. While any toenail can become ingrown, it usually happens to the big toe. An ingrown nail occurs when the skin on one or both sides of the nail grows over the nail's edges, or when the nail itself grows into the surrounding skin. This can lead to redness, pain, and swelling at the nail's corner, potentially followed by an infection. Sometimes you might notice a small amount of pus draining from the affected area. So what causes an ingrown toenail? Ingrown nails can happen for various reasons. In some cases, it's a natural condition where the nail is too big for the toe. Trauma, like stubbing your toe or someone stepping on it, can also lead to an ingrown nail. However, the most usual cause is wearing shoes that are too tight or not taking care of your nails properly when grooming and trimming them. So how do you treat an ingrown toenail? Let's first look at the non-surgical treatment. When you notice an ingrown toenail, it's important to take care of it right away. If you catch it early before it gets infected, you can try some simple steps at home to avoid needing more extensive treatment. Number 1, soak your foot in warm water 3 to 4 times a day. Number 2, keep your foot dry for the rest of the day. Number 3, wear comfortable shoes that give your toes enough space. Consider using sandals until the issue gets better. Number 4, if you are in pain, you can take ibuprofen or acetaminophen. Number 5, if there is no improvement after 2 to 3 days, or if the situation gets worse, contact your doctor. Number 6, you might need to gently lift the ingrown toenail's edge and place some cotton or waxed dental floss between the nail and your skin. Change this every day. Now let's look at the surgical treatment. If your toenail is showing signs of excessive inflammation, swelling, pain, and discharge, it's likely infected, and you should seek treatment from a doctor. Treatment may involve oral antibiotics, and in some cases, a portion or the entire nail may need to be removed. A doctor can perform a surgical procedure to remove part of the nail, the underlying nail bed, adjacent soft tissues, and even a section of the growth center. Surgery is an effective way to prevent the ingrown toenail from cutting into the surrounding flesh as the toenail grows forward. In some cases, especially for children with chronic ingrown toenails, permanent removal of the nail may be recommended. If you are experiencing significant pain or if the infection keeps recurring, your doctor might opt for a partial nail avulsion. This procedure involves injecting your toe with an anesthetic and using scissors to remove the ingrown portion of the toenail, being careful not to disturb the nail bed. An exposed nail bed can be very painful. Complete removal of the ingrown toenail increases the risk of the toenail growing back deformed, and it may take 3 to 4 months for the nail to fully regrow. So, how can an ingrown toenail be prevented or avoided? To avoid ingrown toenails, it's best to protect your feet from injuries and wear shoes and socks that give your toes enough space. When cutting your nails, make sure to trim them straight across using a clean, sharp nail clipper. Avoid tapering or rounding the corners, and don't cut them too short. Keep them in line with the edge of your toe. and keep your feet clean and dry always. Furthermore, you should visit your healthcare provider about an ingrown toenail if you, number 1, have diabetes with complications. Number 2, notice signs of an infection like pus, liquid drainage, extreme pain, or redness. Number 3, experience poor circulation. Number 4, have tried antibiotic ointment, soaking, and self-care, but your toe still hurts. Moreover, if you are dealing with an ingrown toenail, here are some questions you can ask your doctor. Number 1, is the nail infected? Number 2, what's the best way to treat it? Number 3, do I need surgery? Number 4, how can I prevent it from happening again? Number 5, do I need any medication? And number 6, what's the right way to cut my nails to avoid this issue in the future? Thank you for watching. Please like, comment, and subscribe. Watch more videos by clicking on the video here.